Here at HIMSS 2019 with TigerConnect and Dr. Will O'Connor. He's the CMIO of TigerConnect. Welcome, Will.
Thanks for having me, John.
Yeah, so it's exciting. You guys announced an interesting group video solution for healthcare organizations. Tell us a little bit more about it.
Yeah, it's been pretty exciting. We've been working on it this past year. We had a lot of feedback from clinicians, from some of our clients, that they wanted better collaboration tools that would allow them to collaborate in real time and more quickly. So we launched our group chat at HIMSS. We've gotten a lot of good feedback on it, but it allows for up to 15 providers at a time to collaborate in real time about a patient.
Wow, so are they using it for individual one-off conversations, or is it kind of boards that are going, or are we going to just see a wide variety of it?
Yeah, there's a wide variety of it. Certainly there's the ability to have video conversations one-on-one, but as patients become more complex and care teams grow, it's nice to be able to add additional care team members into that conversation real time to improve patient care.
No, I love that you're bringing them together on video. I mean, you've always been known for the secure text messaging, but video is such a powerful thing for a lot of the conversation, especially when you're collaborating multiple people. You lose some message in text sometimes. So that's great. Well, one of the other, kind of themes of HIMSS, I think, as I've talked to a lot of people, is physician burnout. A lot of it, they, blame the EHR for EHR burnout and the challenges. So, what are some of the things that you're doing and the things you're seeing where doctors are really benefiting from the solutions you provide?
Yeah, we agree. We're seeing a tremendous amount of burnout in the physician community. We know now that physicians are spending up to 2 hours on documentation and EHR tasks for every hour they're spending on direct patient care. And we feel like the technology has moved the industry in the wrong direction, and EHRs are all about clicking and coding, and that's not what patients need, and it's not what physicians need. Yeah, exactly. They're really designed to drop a bill. And what we're trying to do is come up with technology that's improving patient care and improving the lives of the clinicians that are using it. So, through TigerConnect, we're able to provide tools that are allowing physicians to collaborate and communicate in real time about patients. So instead of worrying about, what code they're putting in the EMR and dropping a bill, right, and having to go home at night and do additional documentation, we're providing them tools simply to make their jobs easier and make them more effective.
Are there some specific use cases where doctors are just like, oh man, you saved me so much time because I was able to communicate more efficiently or effectively?
Yeah, it seems now every client I go to, I get stories of that every time. And there's been some amazing stories of patient lives specifically saved by the use of our tools, in addition to much better care being provided. We're working with a lot of value-based customers, and they have some vested interest in, instead of driving fee-for-service care of bringing patients into the hospital, really trying to keep the patients at home and keep them out of the hospital. And our tools have been very effective in doing so, allowing clinicians to communicate synchronously and asynchronously in order to provide that better patient care, really exchanging that information for the best interest of the patient. So really focusing on that end result of delivering great care to the patient. And that's what we're seeing with our tools. And quite frankly, we're able to provide some things that a lot of the EHR companies have not been able to provide. We're really all about open communication and open channels versus siloed data and lack of data sharing that we see from a lot of the EHR companies.
And so is that where you see it really heading, is really now moving towards the patient? I know you do have the doctors, the nurses, you facilitate all that communication. Are you moving to the patient, and where is secure communication really headed?
Yeah, we are. We actually just launched our patient-facing initiative here at HIMSS, and we're taking very seriously trying to engage the patients in their care. We have seen patient portals be largely a failure. I think there's been some pockets of success, and I've talked to some providers that feel like they're getting 30, 40, 50% adoption, but most of the nationwide studies peg patient portal usage somewhere less than 10%. So that really hasn't been effective. So what we're trying to do is, instead of requiring patients to pull information out of a portal, we're pushing information to them and pushing messages to them. So clinicians, nurses, doctors' offices, hospitalists, emergency room physicians now have the ability to go out and communicate directly with patients over SMS, which is how you and I communicate, and pretty much everyone else on the planet is starting to communicate. So that's really what we're providing, and have seen some pockets of success with that already.
Well, it's such a powerful idea. I mean, the reason the portal is accepted is because something is better than nothing, but it didn't mean they actually like it.
Yeah.
I mean, their mind's going to be blown when the doctor actually sends them something proactive. Right. I love that idea of push versus pull. Yep. Well, thanks so much for sharing your insights. You know, we've been here with Dr. Will O'Connor. He's the CMIO at TigerConnect. If you want to check out this video and other great healthcare IT content, check it out at healthcareittoday.com.